Nigeria records 58% immunization in 2018. It's significant progress in routine immunization compared to previous years.
Protests in Nairobi, Kenya, after an investigative documentary implicates Kenyan banks in money laundering for corrupt Sudanese officials.
Celebrating 116 years of the Egyptian Museum in Cairo. After over a century of housing most of Egypt's ancient antiquities, the Egyptian Museum is getting a bigger footprint. Africa 54 starts right now.
Hello and welcome to Africa 54. I'm Chamberlain Uso at Channels Television here in Lagos. I'm joined by Vincent Makori at Voice of America in Washington.
Well, thanks. I'm Vincent Makori at our global headquarters in Washington, D.C. Happy to be with you again for another edition of Africa 54. Let's start off with a look at immunization in Nigeria. Chamberlain, also in Lagos, brings you that story.
Oh yes, Nigeria is making significant progress in routine immunization compared to previous years. This, according to the National Primary Healthcare Development Agency, says it has recorded 58% immunization coverage this year. According to the director of the agency, Dr. Faisal Shoaib, the figure signifies an 8% increase from what was recorded in 2016.
Prevention of communicable and non-communicable diseases is an important aspect of public health care. At the forefront of saving the lives of millions of children is the National Primary Healthcare Development Agency through routine immunization across the country. At this meeting in Kaduna, our public health workers from local government areas in Kogi, Niger, Plateau and Kaduna states to assess the level of progress and the challenges.
The results are actually evident, they are showing up. And what it has told me is that, yes, funding is an important component of success, but it's not the be it all and end all of success in immunization. That just that can-do attitude, that mind to the result that we are looking for, that consciousness that what we are doing here is to save children's lives, to get them to be vaccinated so that they can grow up to be the leaders of this country.
In July this year, the National Primary Healthcare Development Agency established the Emergency Routine Immunization Coordination Center to improve immunization in children.
What can we do to ensure that all our children have the vaccines that they need? It is the same spirit that has driven polio to near eradication in Nigeria. And it is an amazing time for all Nigerians because within our lifetime, we will see an ancient prehistoric disease being actually kicked off the face of Nigeria, that we will live a life where none of our children will be threatened with paralysis from poliomyelitis.
According to the Executive Director of the National Primary Healthcare Development Agency, 58% routine immunization coverage has been recorded this year, an 8% increase from previous records.
What the recent SMART survey shows is that we've actually jumped by 8%. That is huge in terms of the ability to move from one level to another in terms of percentages. Is unprecedented that within this short period, within the administration of President Buhari, we've been able to jump 8%. If you check the literature globally, there are very few instances where you've seen this kind of jump. The best case has been 6%. So again, Nigeria is taking a very brave and solid march towards improving routine immunization.
With a target of 80% immunization coverage by 2028, there's still work to be done, but the agency believes the right structure is in place in terms of coordination and efficiency.
Joining us now for more on strengthening routine immunization in Nigeria is Dr. Faisal Shoaib. He's Executive Director and CEO of the National Primary Healthcare Development Agency. He joins us from our studios in Abuja. Well, thank you for joining us on the program, Doctor.
The pleasure is mine. Thank you for having me.
58% immunization coverage, that's quite some ground to cover. Could you then tell us, what did you do differently to achieve this?
So there are a number of reasons why we've seen this improvement in routine immunization coverage, but I sort of maybe encapsulate all of them into 4 major areas. First and foremost, the leadership and accountability that has been engendered by President Buhari, and the fact that because he's focused on primary health care, the strategic direction of the Honorable Minister of Health has been how we can strengthen primary health care. Immunization is one of the components of primary health care. So right from when they came on board, we've had a lot of focus on how we can improve routine immunization, and this is why we're beginning to see progress in terms of routine immunization coverage. Secondly, is the fact that we've now gone back to the grassroots and involved the traditional leaders. This is exactly the same approach that helped us get to near eradication of polio. So through the traditional leaders committees, both in the north and the south, we're beginning to see communities demanding for routine immunization. Thirdly, is the fact that under this administration, there has been no stock out of vaccines. So that has been very, very massive in terms of its contribution towards making sure we see improved immunization. So I can imagine that in the next few years, we're really going to move rapidly towards attaining the 80% minimum coverage for routine immunization.
What would you say are the constraints to attaining maximum coverage of routine immunization in Nigeria?
Right, so a very important aspect of the barrier is the fact that some states do not have a dedicated budget and release for routine immunization. So you go to some states and the health workers who are really committed do not have the funds required for them to carry out supervision of health facilities. They do not have the funds to move the vaccines from the state and local government cold stores to the health facilities. They do not have the funds, the resources to carry out fixed sessions and outreach sessions. But again, we're beginning to see through collaboration with the state governors that more funds are being released. We're also working with our development partners, and we're beginning to see that more funds are being released. There's also the issue of accountability and transparency. There's also the issue around how we can ensure that in every ward, we had one functional cold chain equipment. So cold chain equipment that will ensure that our vaccines are kept potent. Right now, a lot of the health facilities have to go to the LGA stores to get their vaccines on the day that they are providing immunization services. This sometimes leads to delay in parents getting the vaccines for their kids, and the long wait sometimes discourages them. But in the next few months, there's a plan for us to procure as much as 6,500 cold chain equipment that will be distributed all over the country to ensure that minimum in every ward, there's a dedicated cold chain equipment that will store vaccine. So that will help us overcome some of the challenges we have with cold chain.
Now, with respect to primary healthcare, and in fact, healthcare in general, one key issue that comes up is funding. Are there sufficient funds or provision for vaccine and other immunization needs to cover the large population?
Right. So in the past, we've not had adequate funding, but courtesy of the different partnerships that we have, and then now the Gavi Alliance has provided some funding, but also President Buhari will be launching the Basic Healthcare Provision Fund in the next few weeks. We have 55 billion naira as part of the 2018 budget. For the first time in the lives of Nigerians, you will find a situation where women and children will go to health facilities with little or no cost for their treatment. That's unprecedented. Part of this cost that will not be borne will also be the investment we'll make into availability of vaccines. So part of the basic healthcare provision fund will also be used for the procurement of vaccines and also the operationalization. How do we get the vaccines to the last mile?
What key areas, if addressed, would improve routine immunization in the country such that the set targets will be met?
So, for example, we've talked about the finances. The finances are on the up. We've talked about the leadership that has to go all the way to the last mile that is being provided. Yes, at national level, there's leadership that's provided by Mr. President, the Honorable Ministers of Health, the National Primary Healthcare Development Agency, the State Primary Healthcare agencies, the governors. Leadership at all levels is very critical towards reaching our targets. Increasing awareness about the usefulness of routine immunization vaccines. Now that is improving, but we always will rely on the media to also support us, and we've always been partners in doing this, but we always need that partnership to ensure that the information gets out there, that vaccines are safe and the vaccines are required, right, for kids to grow up and live healthy lives. And then, of course, there's the issue of accountability, that anytime any Nigerian goes to any health facility, that they should be treated with compassion.
All right, Dr. Faisal Shoaib, Executive Director and CEO of the National Primary Healthcare Development Agency. Thank you for joining us today on Africa 54.
Thank you. It's been my pleasure.
Well, I want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54, and check out our headlines 24/7 on voaafrica.com. Coming up, Nigerian youth provide solutions to national issues, especially through the use of technology.